Surgeons and doctors of Reddit. What's the dumbest thing patients have lied about? Story 1. Part of my job is dealing with medical records. My favorite part is when you are reading the doctor's notes and you can tell they are fed up with the patient's bullshit from their tone. Patient in for routine colonoscopy. Asked if solids consumed in 24 hours prior. Patient confirms no. In the process of procedure, several dozen kernels of corn are discovered in the colon and cannot continue. Patient specifically instructed not to consume corn beforehand, as this happened prior to visit. Story 2. A common one is about their smoking. Smoking is an enormous risk factor for fracture non-union, meaning a fracture that doesn't heal. When I walk into a non-union patient's exam room and it smells like a cigar den, I know they smoke. But they'll tell me they aren't, right to my face. Before signing them up for revision surgery, I'll commonly order a urine test for nicotine metabolites. Often it'll turn out positive, and suddenly, surprised Pikachu face. Lots of folks commonly believe that if you're a smoker, your insurance premiums. This is true. However, the cost of complications after a surgical procedure would dwarf a lifetime of increased premium costs. I would still recommend that smokers be straight with their surgeons so they don't rush into surgeries that end poorly. Story 3. Had a guy in the ICU who had come in with a perforated bowel and had to have it fixed. He was a misogynistic, racist fuck and would rant at any woman or foreigner who came into his room, aka all the doctors seeing him. But, during his being a fucking ass, he would throw in there how he was injured. Turns out, he and his wife were smoking crack, which he said was a hobby of theirs. He then had her fuck him with a pool cue and perf his colon. She had been at work all day and came in and said something about how weird it was that he got this injury from a fall. I was like, he has told everyone the truth while going on racist and sexist rants. Was super weird. Story 4. One of my favorite things I wrote my first year out of medical school. Please note the patient has stated multiple times that he wants to leave and would leave AMA against medical advice. He asked multiple times whether he could eat and stated he was hungry. Explained to the patient that we would like to start a full liquid diet first, and if he tolerated it well, would transition to regular foods. However, PT ordered Chinese food delivery instead. Then, the patient was complaining of a headache, was given Tylenol for the headache. Patient stated this did not help him. His sister at bedside went to the nearby pharmacy and bought goody powder, aspirin. Sister did ask whether she could give him goody powder. She was told not to give patients the goody powder. She supposedly did not. For context, the patients had a catastrophic GI bleed from taking too much aspirin. Story 5. Not considering the psychiatric and the boring answers, like people who just swear with all their heart that they are taking their medications when they clearly aren't, which is the vast majority. There's not much really. Only one really unique comes to mind. It was a patient, a really kind old man who would always talk a lot with us, telling stories, praising the beauty of everyone in a tender and respectable way, saying how really grateful of our work he was and so on. Said old man would always appear with really high blood pressure values, even though he would swear that he always used his medication correctly. And after we did so many changes with his medication in many different ways, it's only natural to think that there's some problem with how he's taking them, if he was doing it at all. However, one day, after noticing that he would always go to the bathroom before reaching out to the receptionist, someone discovered he would always eat a load of pure salt before being seen by any of the doctors, trying to make his pressure intentionally go sky high. Later, we also, obviously, discovered that he indeed would not take his medications correctly as well, in order to obtain this result again and again. Turns out, he suffered a lot from loneliness, and he was an old man that didn't have much contact with his family anymore, but mostly because his family didn't reach out to him almost at any given time, even though everyone lived close by. And, in his desperation, sustaining dangerous high blood pressure was the best way that he had to obtain human contact within the emergency every week. This was the most odd one, but it's really common in general among elderly patients to appear lying about their symptoms, only trying to gather some attention and a private minute to speak about anything else. Most of the time, they book an appointment only to talk about recent trivialities, which makes them clearly better, although by the end of the talk, it's also easy to see how they gather back part of the sadness that the loneliness brings to them. Around my patients, at least, it's common for many to cry as they leave. Loneliness is a hell of both a simple and complex problem, and one that no one should be bound to live with. Story 6. Their age. Had a woman say she's 30 when she clearly didn't look like it? Oh well, I move on to other questions. Look at her files and lab reports that have her real age on them. 41. Like, why though? What difference does it make lying to healthcare staff? This is health related, not our Tinder profile. Nobody's gonna see this and go, I ain't dating an old lady. By the way, she was married with children. Story 7. Me. Have you had anything to eat or drink today prior to your surgery? Patient. No, with a half-eaten candy bar in front of them. Me. Are you sure? Because if you have, you could vomit upon going to sleep and it could enter your lungs, causing you to die. Patient. Then yes, I have. I had half that candy bar. Story 8. This one guy repeatedly used to come in saying he hadn't shit in 7 days. This would usually necessitate a rectal examination with a finger. That's why he kept saying it. Patients used to come in every time the new doctors rotated in, who wouldn't be wise to his tricks. Story 9. One guy came in feigning unconsciousness. Did not respond to even the most painful of stimuli. Some of these were pretty painful. Did not budge. We were talking amongst ourselves about intubating him. He then opened his eyes and said, "They did that last time. I didn't like it." Story 10. Guy came in for a wound on his lower leg that he said came from a biking accident. X-ray revealed a bullet inside his ankle joint. The wound was from shooting himself by accident while holding a gun. Still don't know how he didn't fracture anything. Story 11. Honestly, the dumbest lies are the ones people who lie about how much alcohol or other drugs they use. Alcohol and benzodiazepine withdrawal can kill you, and if you use opioids from the street, then you likely have a higher tolerance and may need more medications in the hospital, so be honest. I truly don't care how much you drink or use, I just don't want you to get worse for something we can plan for and prevent. Story 12. I had a lady tell me she had no idea how she got a rash she had on her face. I left the room, gave a report to the MD, and when I walked back in with the doctor, she looked at me and said, "I didn't think you'd be coming back in the room," and then proceeded to confess that she'd been cheating on her husband and thought she had herpes. She did not have herpes. Story 13. Do you have any medical problems? No. So no diabetes? No diabetes. What medications are you taking? Metformin for my diabetes. I facepalm every time. Story 14. It's not so much a patient lie as it's me being dumb, inexperienced, and uncomfortable asking necessary questions. I had a hypothetical patient during residency that was a very manly veteran, and I was admitting him for rectal bleeding. He was in the age where it is more than likely colon cancer, so I didn't think it was necessary to ask for a sexual history. Folks at this particular establishment were known to at times be homophobic, and I had been yelled at by patients previously for asking, "Do you have sex with men, women, or both?" It ate away at my conscience, though, so I went back in absurdly nervously and asked him. He answered, "Son, I'm as gay as a rainbow. I've been at the bathhouse for the last couple of nights, but I wasn't sure how it would go over to admit it." That's when the bleeding started. It was a very important lesson for me. Story 15. Penis modification. The case was an elective above-the-waist surgery, and he denied piercings. However, when the nurse went to place the Foley, she found the patient had modified his penis and it was split/bifurcated with multiple piercings to look like a cobra. The nurse did not know how to insert the Foley. The piercings also limited the ability to use electrocautery. In addition, he also embedded a metal implant inside his testicle that looked infected with a possible abscess. Cancelled case, called urology consult for infection/abscess evaluation. Story 16. Patient. I haven't drank alcohol in months. Patient's family. It's true, I've been with her the whole time. Me. Ma'am, your alcohol level is 325. Patient. Impossible. I would never lie to you. Story 17. One dude lied about being paralyzed after a lumbar puncture. A nurse patient says he can't move legs following a lumbar puncture, spinal tap. I called the team that did the procedure and they assured me there was no indication of this sort of injury happening during the procedure, but agreed with my plan to get an urgent MRI. I go to examine him and the nurse says she thinks he moved one of his feet. Next thing I know, he says he can actually move his legs again, but they are feeling weird. Then this weird feeling turns into intense pain and he asks for intravenous narcotics, Dialidid. I tell him no, because the story makes no sense. By God, it was a miracle, I tell you, when this man walked himself right out of the hospital after I refused the IV narcotics. Also, the MRI was normal. Story 18. Nurse here. The absolute dumbest thing patients have said. And to be fair, this was the patient's parents since I was in PD but still dumb as fuck and caused no end of grief trying to unspin it. I was rooming patients and I went to the full lobby and called the next one by my last name. They stand up and mom and dad bring the little girl back. I'm rooming them, taking the vitals, reviewing the purpose of the visit, making some adjustments to the chart, updating their pharmacy and allergies, and going out and letting the pediatrician know they are ready. The pediatrician goes into the room and comes out like 3 minutes later and says, "That's not my patient. Where is my patient?" I'm like, what the fuck? I go in and ask the parents, and no, in fact, they were not the patient. I'm like, why did you say you were someone you were not? They simply said they didn't want to wait, so they just came back. We had to completely unspin all the changes to the chart and had to get legally involved to make sure there were no HIPAA violations, which fortunately there weren't. I'm fascinated that people can collectively think, yeah, let's do this. No one will know. Like, how does that even play out in their minds? Story 19. Had gastric sleeve surgery several years ago. 2 weeks before surgery, you start a liquid diet to shrink your liver or the fat around your liver and make surgery easier. Also makes recovery easier. Psychologists shared that one patient had food in their stomach when the surgery was started, so not only did they not do the liquid diet, they also ate 12 hours before surgery. This was part of our discussion of how they decide who is ready for surgery. They all felt this patient was ready, compliant, etc., and the day of surgery totally blew it. The surgeon stopped the procedure on this patient and closed up. I was shaking. It was such a journey to get surgery, it would have been devastating. Story 20. Women come to emergency with complaints of vaginal discharge and discomfort. Pelvic exam initially reveals significant yeast infection, but there appears to be a foreign body in her vagina. Is there something stuck inside? No, I don't know what's in there. Speculum examination reveals a very soft mandarin orange peel still on. Oh, that. We heard it would improve our fertility. You can't make this shit up. Story 21. My little brother was a nurse for about a decade. He has said many times that people stick anything up their butts, from light bulbs to hairbrushes to a golf shoe. And at first, it's hilarious. Then, after a year or so, it's not funny because you've seen way too many distended buttholes. Then, after a decade or so, it starts to get funny again, because you think you've seen everything, and then one day a 45-year-old man is driven to the hospital by his wife, and he has a golf shoe up his ass, and he told his wife that he and the boys were golfing, and he slipped in the locker room and got it rammed up there, completely disregarding the fact that the part of the shoe that is inside him is covered in Vaseline. Story 22. First baby, never pregnant before. New OB appointment. We collect everything and do exams. I put a speculum in and I saw her cervix. After her partner left the room, I asked her again, and she said she doesn't want her new partner to know that she's a single mom. Not dumb, but just very obvious on an exam that she has definitely given birth before. I left a note on her chart to not mention prior pregnancy in front of her new partner. Another. On my gen surgery rotation as a medical student, removing objects from rectums due to unfortunate falls. Story 23. I had a patient that lied about having a job. I asked because he had hepatitis A, and I wanted to know if he needed a medical leave. He denied it, even though I asked twice. Next day, he came back because he was going to get fired if he didn't provide a doctor's note. ETA. Some clarification. I'm in Venezuela. He wouldn't have had to pay anything for that visit regardless of his employment status. He isn't an undocumented immigrant. It's a very small community where everyone knows each other, and he has lived there his whole life. And many of his relatives have also been my patients. Also, undocumented immigrants aren't really a thing here. Some tourists may come without having the proper paperwork, but this isn't really a desirable place for immigrants looking for work. He said that he didn't have a job. He didn't say that he didn't need a medical. I asked what he did for work on his second visit, but I can't remember what he told me. There really isn't a whole lot of stigma around Hep A around here, even if you work handling food. People just sort of feel sorry for the person and tell them not to eat yellow things. So I don't think it was because he was afraid of being shamed or reprimanded because of it, but I could be wrong. Story 24. Resident doctor here. This happened during my psychiatry rotation in medical school. I wouldn't say it was a dumb lie since the patient was mentally ill, but I would say it was the most memorable lie. There was a patient at an inpatient psychiatric facility for suicidal ideation. She constantly insisted that she had a mass on her breasts and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during the daily patient interview. I also declined the physical exam, but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently this lady had frequented many doctors' offices with various complaints of an unspecified nature and would usually focus on breasts or vaginal complaints when she visited male physicians' offices. We diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seemed her goal was mostly attention from medicinal professionals. She had lots of issues, but we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously, so the patient won't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her health problems exist, and her primary goal was the attention from medical professionals. If she actually believed she was sick, we would have diagnosed her with an illness anxiety disorder, commonly known as hypochondria. Story 25. The worst I've heard was from the ED. Common question before shooting an X-ray is how did it happen, because I may have to use an optional position or something. From women. I tripped on the rug, I dropped a heavy box on my hand or foot, it was dark and I didn't see that the door was open. There's always a social worker in the ED, and we'd take her to imaging for better shots. Sometimes radiologists would order a SNAT series, suspected non-accidental trauma. Where there's one break, there's always a history of more. Story 26. I was actually surprised when a few years back I had a more clumsy than usual streak and ended up in the same ER 4 times within a 6-month period for various injuries. 2 sprained wrists and bruising, scooter accidents on the way to and from work, stitches, bleeding, bruising, and suspected concussion, got up to pee in the middle of the night and passed out, hitting my face on the tile, and torn ligaments in my ankle resulting in swelling up to the size of a football and turning black and green. They swore it was broken, but it was surprisingly not. I stepped on it wrong, and none of those times did they ask about a DV situation. Friends and I were surprised because if I was a doctor seeing a young woman, late 20s, come in with that many injuries of those types in such a short period of time, I would be incredibly concerned. Maybe because I came in alone each time they assumed I'd volunteer the information or say something if I was in danger. Story 27. Dad is a physician who had a million funny stories. He told me this one from a few decades ago. Had a patient come into the ER with a towel over his groin, covered in blood. Claimed he was cutting vegetables in his kitchen and the knife slipped. Dad takes a look and the guy is butchered down there. Had to call a urologist in the middle of the night to consult. Guy eventually confesses trying to give himself a circumcision because he didn't want to pay the $200 it would have cost. Urologist was able to save him, but it cost a hell of a lot more than $200 for emergency penis surgery. Story 28. I'm just a med student, but a doctor shared this with us. She's a gynecologist, and this woman came to her complaining about how she hasn't gotten her periods in a few months, and while she wasn't showing menopausal symptoms and in fact looked almost 50, but she kept saying she's only 30 and she can't have menopause. It has a funny ending. When the doctor asked if the woman had a kid, she said yes, he's 27 years old. I don't know why people lie about their age, but this was a funny story for the whole class. Story 29. I work in ophthalmology. I see patients nearly every week that are faking vision loss. Most often, it's to try to get a disability. Sometimes it's just attention-seeking or extreme stress and anxiety. In rare cases, patients truly believe they cannot see or have convinced themselves they cannot see, when all the exam findings and testings are normal. It's called non-organic vision loss.